Hi, this is pharmacist Curtis Alexander. In this video, I'm going to be going over Cymbalta side effects. I'll cover some of the more common side effects that you might see, as well as some of the warnings, some of the more serious side effects that can occur. They're rare, but it's important that you know about them. Before we do that, go to curtis-alexander.com. I have a free report if you're looking for options outside of drugs and surgery. So let's hop right into it. So Cymbalta's been around a little bit now. It's available as a generic called duloxetine. Let's talk about, first of all, what it's doing in your body. It's a combination drug, so it actually it's a reuptake inhibitor. So your body will take back up serotonin and norepinephrine, which is like adrenaline. Cymbalta blocks that process, so it causes your serotonin and your norepinephrine to go up. All right. Now, it's always important to know that because it will help you understand why some of these side effects occur. So the more common ones, we see a fair amount of nausea, 18 to 25%. That is dose related. Obviously, as the dose goes up, we're going to get to this higher end. An interesting one, adults, we do not see a lot of weight loss, but when it's used in kids, you can see a 15% incidence of them losing weight. For most people, they'd love to see that as adults, but it doesn't happen that way. Headache is another common one, 13 to 18%. Dry mouth can happen, 11 to 14%. Again, these are dose related. That's why we have the ranges. And drowsiness and fatigue, this is one I have feedback a lot from people who use it, upwards of 11% of people. Now, there are certain groups of people that want to be very careful about using Cymbalta. This is where we're going to get into some of these warnings. These are not common side effects, but if they happen, they tend to be serious. So these are groups of people we want to be careful. Number one is bipolar. If somebody has a history of bipolar and maybe they're not being treated, but they use Cymbalta as monotherapy, it can throw them into a manic episode. So we want to be careful with these folks. We can see an increase in bleeding risk. We believe that it's related to the 5-HT, which is the serotonin effects of Cymbalta. So if you have bleeding risk, something to be careful with. Fragility fractures, not exactly sure why this happens, but you can see increase in fracture risk. We think it's serotonin, but not totally sure. Liver toxicity. This is primarily, we believe, due to the potential for drug interaction. So as always, if you're getting Cymbalta, ask your pharmacist to run a complete interaction check on everything you're taking. We can see sodium levels go down, we believe, again, related to the serotonin effects. Acute angle closed glaucoma risk goes up. So if there's any sort of eye glaucoma concerns in your family or your history, you'll want to know about that. Obviously, with all these drugs that affect serotonin, serotonin syndrome can happen. So if you're taking other medications that affect serotonin, you want to be very careful. We can see sexual dysfunction in men, erectile dysfunction, women, lack of libido, those sorts of things. Suicidal thinking and behavior issues. Generally speaking, I'm painting broad brush strokes here. We worry about this more in kids and adolescents. Once they hit that 24 years of age, the risk goes away. At least that's what the studies show, but obviously something you want to be careful about. And finally is withdrawal. The important thing to note about Cymbalta, its half-life, or for example, if you were stopping Cymbalta, which you should never stop at cold turkey, and this is why, if you stop Cymbalta, the half-life is 12 hours. That means within 12 hours, 50% of the drug is out of your system. The withdrawal risk is very much there. Never stop Cymbalta, particularly drugs that have a half-life of less than 24 hours. It becomes even more problematic. So Cymbalta is one you want to be careful about withdrawal. Okay, so let me know in the comments, have you taken Cymbalta? Have you known somebody who did? Were there side effects? How was it tolerated? Those sorts of things. Really helpful for me, and it's also very helpful for other people who watch the video, and I appreciate your input. Speaking of helpful, I hope this video was, and I'll see you in the next one. Thanks.